Hey YouTube, it's Jenny and Miss Mystic J. This is going to be a very quick video because my mom ran out to the store for me. I sound weird because my throat hurts. I got out of surgery a few hours ago. I'm sorry I didn't make a pre-op video. I forgot / ran out of time. What did they do? They did a breast lift with or Dr. Katzen, I should say. Did a breast lift with augmentation. I went up to 800 cc high-profile silicone implants under the muscle, I decided. I don't get to see how it looks till Wednesday when he takes the dressings off, so I can't give an answer about that. He did liposuction basically everywhere. Under my arms, my sides, my stomach, my back, my inner thigh, my outer thigh, my inner knee. I think that's it. He did a Mons lift to get rid of my fupa. I have one drain. Where did it go? I have a drain here somewhere. Oh, there it is. Ta-da! One drain. It's not draining too much. And I also, at the last minute, you know me, I asked him to put some of the fat into my lips. You tell? Sorry about the blood on them. They're too sore at the moment to wipe them off, but yeah. They're swollen right now, so he said basically don't freak out, they're going to go down. I like how they are right now. Like, if they stayed this full, I'd be ecstatic. So maybe I'll have him put more in later if they go down. Putting fat into your lips rather than Restylane or any of the other foreign liquids that they put into your lips, putting fat transferred from elsewhere in your body lasts the longest. He said it will probably last up to 2 years. And I asked him this morning, I said, if I'm absolutely in love with how they look, which I am, and 2 years from now they go down, instead of doing it again, if I did lip implants, would it look the same? He said yes. So that's on my radar for the future, a couple years from now, or however long it takes for the fat to disperse again. That's when I'm going to look at possibly just putting implants in, so it's permanent and I don't have to worry about it again. I do not have a pain pump. I do not have a catheter. I'm on Percocet at the moment. Antibiotics, blood thinner shots, all that good stuff. I will say this to anyone thinking about doing liposuction. For me, at least, the lipo that he did everywhere has been, so far, it's only day 1, so far has been 5 times more painful than having the skin removed. It's worse than the body lift, it's worse than the boobs, it's worse than the lips, it's worse than the arm lift. I mean, there was pain with those, but it was easily manageable. This, like, I literally can't move without making some sort of noise. Like, not screaming, but it's like, ow, ow, ow. Like, it hurts, people. So just as a side note, if you're going to be doing lipo, especially everywhere like I did, just be prepared. You're not going to be moving for a while. It hurts. He wanted to leave the catheter in until my until my post-op appointment. I told him I really didn't want it. I don't have to go to the bathroom very often. I don't want that risk of infection, so he agreed to not do it. Honestly, I'm kind of wishing I did it, because anytime I get up I'm in a lift recliner that I rented, thank God, because there's no way I could stand up on my own. There's no way. What is the pain like? Like right now that I'm not moving, it doesn't hurt at all. Doesn't hurt at all. Anytime I move, like I have my legs crossed right now, when I go to uncross them, it's going to be hurting. Standing up hurts. And I wasn't expecting it. I knew I was going to be, swollen as hell. Possibly black and blue, although I'm not black and blue yet. Yet. But it feels like... what does it feel like? It feels like... It feels like my muscles were cut into. Like the muscles in my thighs are on fire when I try to use them. The muscles in my butt feel like they're on fire when I try to use them. And he didn't take anything out of my butt. He just took them out of the sides of my hips. My back. Like, I can lift up my legs. Oh, hang on. Like, I can bend my knees just fine. And normally I would do that, bend my knees and, put them as if I was going to stand up, like put them on the edge of the recliner part where the feet are and push myself up if I, tend to kind of slip down on the seat. I cannot do that because the area where he lipoed in my back hurts too much to put that kind of pressure on it. So I literally have to stand up and sit back down to scoop myself up. It's pretty intense, honestly. I'm not trying to scare anyone out of doing it. Yes, I would do it again in a heartbeat. I can already tell I'm gonna love the results. But damn, Gina, it hurt. It hurts. Like I said, it's a muscle pain. It's not the skin or probably from the swelling, but it's not the skin. It's muscle pain, like really intense muscle pain. Like you just did the most intense workout of your life, and then someone went along and bruised the heck out of them. Like, I don't know. I wasn't expecting it to be quite so intense. But again, I would do it again. So yeah, I'm loving I keep puckering. Just because it feels weird. My lips are still numb because he got them numb when he did it. So I'm still numb, like, in this middle part. But I love it. When I smile, you can still see part of my lips, so it'll be easier to wear, like, lipstick and stuff. Like, it's not going to get all over my teeth. I'm excited. I'm really excited about my lips. Yeah. I'm liking it. I'm really liking it. So yeah, I definitely do that again in a heartbeat. Like I said, or the lip implant, most likely. What else do I have to tell you? I don't know how much fat he took out. I'll ask him at my post-op appointment, which is next Wednesday, so you're gonna have to wait. My throat's scratchy because they had, a breathing tube down my throat. Oh, the surgery was 7 hours, almost exactly. And it was at a new surgery center. Usually he was working out of Sunset Surgery Center in Beverly Hills. Now he's working at the Institute of Plastic Surgery, I think it's called, something like that. It's literally like right behind his building, like where his regular office is. It's like right around the corner behind it. So that's convenient. I had about a 50-minute drive to get back to the hotel. That was totally fine, except when we hit bumps and it moved me. But once I got in the car, I was fine. Getting in and out was painful. What else? I don't really know what else to say right now. I'm at almost 10 minutes. I will make a video later to clarify anything that I'm forgetting right now. But yeah, I just wanted to come in and tell you guys I'm doing good. Oh, I'm a little concerned because, so I have, let me show you. Right now, I just have an ace bandage over my boobs. And this needs to stay on until next Wednesday when he sees me, and then he's going to put me in one of those post-surgical bras. Like I said, 800 cc's under the muscle, silicone, high profile. The only thing I'm worried about, and it hasn't even been 24 hours, people. This is just me nitpicking everything. I'm not seeing a whole lot of cleavage. Maybe it's because everything's so swollen. I'm assuming and hoping that's what it is, but at this point, that's the only thing I'm kind of questioning. I'm like, did it work? Because that's the only reason I went bigger, is because I wanted to get more of that cleavage look. So we'll see how it looks after, you know, a week or two or a month or whatever. Anyway, that's my update. I will update you guys again later. If you follow me on Facebook, look for an update there too. And I will talk to you guys later. Mwah. Kissing you with my nice big juicy lips.